So one of the biggest things that we will go into patients and discuss about is the difference between a sleeve and a gastric bypass. And as you've heard us say, I do not think that we do not think that there is a perfect operation out there for, everybody, but it needs to be individualized. But a big discussion is what are the differences between a sleeve and a bypass? Because those are the frequently performed surgeries for bariatric and weight loss. So first of all, I think my biggest concern after any surgery is the durability of that. Is our patients going to maintain their weight loss? Are they going to lose the appropriate amount of weight? And we actually have data to guide us on this. So when you look at a gastric bypass, we have data that we trust around 10 to 15 years out. And what we see is that probably 70% of patients keep their weight off. 30% could be gaining it back, and we'll have discussions about why that might happen. With a sleeve, we don't have that 10 to 15 year data yet, but we have data where sleeves and gastric bypasses have been compared 6 years out. And at 6 years out, what we see is that sleeve patients are doing well, but they're already having issues with weight regain to a higher extent than gastric bypass patients. And that is for a multitude of reasons. But one thing to understand is, again, it has to be individualized. And some patient may do very well with a sleeve, some patient may do very well with a bypass. And I think that you see variability in those durability numbers because of that. I think another thing that we discuss a lot with patients is that people feel that the sleeve is a safer operation than a bypass. And what I would say to that is, down the line, the bypass can have issues that the sleeve doesn't have. But up front, what you see is that the sleeve and the bypass have the exact same safety and efficacy profiles, where we look at issues such as leak rates, blood clots and pulmonary embolus, being pretty much equivalent between the two surgeries. People will also ask about recovery time between a sleeve and a bypass. They're actually equivocal, where we're seeing patients usually come into the hospital, stay 1 to 2 nights with either surgery. We're seeing that patients are on the same kind of graduated diet over the course of 5 weeks, back to regular food with either surgery. And we're seeing that patients return to work usually within 2 to 4 weeks after either surgery. And so it is important to kind of understand that, of how they are very similar and how they can be different. Down the line, there are safety issues with the bypass that are different than a sleeve. And that mostly has to deal with multivitamin issues that are very important after either surgery. But compliance has to be followed with strictly with a bypass and a sleeve. Also, concerns of ulcers in something like a gastric bypass, or twisting of the bowel issues that can happen with a bypass. Those happen usually less than 5 to 10% of the time with something like a gastric bypass. You don't have those problems with the sleeve. But again, we usually do not feel that those are prohibitive issues of moving towards a bypass. And again, all of these things are discussions that you need to have with your bariatric surgeon. One final thing is about diet. And people will say, well, is the diet different between the two? And what I would say is, usually not. Bypass patients, 15% can have what's called dumping, and we'll have a whole different video about what that is. But a majority of bypass patients don't dump, and very briefly, it's usually when somebody dumps after a gastric bypass, it's something where it's a very high fake sugar, kind of high fructose corn syrups that are causing these problems. That is one thing that you do not see with a sleeve, but again, after a bypass, it is something that does not happen to a high amount when we are eating the right foods. But ultimately, after a bypass and a sleeve, you should be able to go back to eating normally. You should be able to go back to eating the foods that you enjoy. We just hope that those foods are healthier for you.